If your score is 0, that doesn't necessarily mean you're safe. It just means it hasn't calcified.
Possibly.
And if your score is higher, that is a very good indication that you have some serious risk factors and are at a much greater risk.
Correct.
So
you can assume that there's probably some uncalcified plaque as well.
Right. Welcome to Generation Health. We bring you the latest news, cutting-edge research, and time-tested best practices helping you live a longer, healthier life. Sitting across from me, Dante DiMatteo, PharmD. How are you, my friend?
Doing all right. Little back pain, but other than that, we're good. We're good. We're here.
My name is Tyler Andrews. I'm the host, and sitting behind microphone number 3 at the moment, Josiah Schweinberg, engineer extraordinaire.
Just getting everything dialed in.
Every time, and we appreciate you for it.
Hopefully.
So what I want to know is, what is the weirdest food combination you've ever tried that actually turned out to be good?
Wow.
Not necessarily the weirdest, but people around me find it strange. It's the savory oats thing.
Yes.
I put eggs, vegetables, usually some sort of hot sauce over oats almost every single day for breakfast. So that strikes people as odd, but it feels so right. It's just as good as the sweet version with the fruit and the peanut butter. And
I don't know if that's true, but I'll go with you. When you eating peanut butter and yogurt really blew my mind until I got addicted to it, and now I do it all the time. So you do have some unique combinations that you enjoy.
We should release our own Tyler and Dante's diet plan. Diet theory.
Oh, yeah, theory. Yeah, exactly. Josiah?
I'm curious now to try the oatmeal with hot sauce. Never had it. I think I'll try it.
It'll be fine.
I did try the peanut butter and yogurt. I'll never do it again.
No?
Really?
I couldn't get down on it. No, I was not a fan.
I mean, it's just, I feel that I've always done that. When making a parfait, healthy parfait, unhealthy parfait, I've always incorporated the peanut butter or not any almond butter.
Greek yogurt.
Greek yogurt. Yeah.
Maybe I just need to experience this Dante and Tyler's.
Yeah.
We'll hook it up after this.
I need to try it.
You got to play with different combinations of, maybe it's this company's almond butter or Jif peanut butter. Like there's different things.
True.
If it's bananas or berry based, there's a whole
It's
algorithm.
the berries with the peanut butter is a strange combo.
So the answer to this question for me is, it's probably not fantastic, but it's the only one I could think of in recent history, is when your wife, Nicole, made me that coffee with, was it orange juice?
Oh, yeah.
Lemonade.
Yeah.
Espresso lemonade.
I think maybe I could get into it, but at first, I don't know. There's something about it I couldn't. And it's a popular thing. It's like an Italian thing.
Nashville is huge on coffee soda, is what we call it. It's cold brew coffee with forced nitrogen carbonation, citrus of some sort, typically like orange zest, and a little bit of simple syrup. And that it's the strangest. The first time I had it, I was like, what is this? This is so, my tongue is lighting up and my brain is doing weird things. And then I got to the end of it and I liked it so much that I came back. I drove from my house 30 miles away back to Nashville the next day to have a second one because it was that good. I don't do that anymore, but
so maybe I need to try that again as well.
Yeah.
I find it to be a refreshing version of a coffee as opposed to just a cold brew or an iced coffee. It is strange. So
it is unique.
It disgusts coffee purists, and I like plain coffee, black coffee, harsh tasting coffees. I like that.
Multiple times a day.
Yeah, exactly. but I can still go for the espresso lemonade. It's refreshing. I do want to just make one more point about the oatmeal,
please,
because someone's going to try it, or Josiah's going to try it, and you're going to leave the oatmeal too runny. When doing the savory version, you got to make sure the ratio of oats to water is higher, so a little less water.
Yeah, it's closer to bread.
Yes. So when you take the bite and you have all 3 or 4 components, it's less of a soup.
Yeah.
Because the egg, so you want to make sure you're cooked through.
Oatmeal egg soup is my favorite.
Yeah, I mean, I'm good with that. I'm pretty deep into the game now. I can handle it, but for somebody just starting, I would suggest to ease into
I'm a novice.
So we can keep with the peanut butter theme here. The strangest thing that I ever had was peanut butter on a hamburger or cheeseburger.
Oh no, that's fantastic.
It's on the Burgatory option list. So I've never done it. I could recite the entire sheet.
So good. There's a burger place in Nashville that I love, and they call it something about Elvis, and it's got peanut butter and pickles.
Yes,
and like cheddar cheese, and it was one of those things that I kept looking at it, going, "This is so weird," and it's on the menu, which means a lot of people get it, but it's so weird. Okay, fine, I'll try it, and So since then, I put peanut butter on just about every burger I get.
Wow!
When I make them at home.
There's a
intense.
There's a restaurant bar near the church, and I used to get it all the time, but I haven't had it in so long. It's called the Dirt Rag.
Oh, the Dirt Rag.
The Dirt Rag. Yeah.
Is that double wide?
No, it's over the bars bicycle cafe.
Yeah.
Oh yeah.
There's one in North Park, but
it is good. It's really good.
Yeah, I haven't had it in so long. Wow, it makes me want to go. Peanut butter pickles. Yeah, pickles on a burger. Wow.
All right. Well,
I'm hungry.
I know it was really dumb of me to do that right now. It is almost lunchtime right now as we're recording. So, but we'll get serious. A while ago, we posted a video about statins and somebody emailing a listener question about whether or not they should be taking a statin, gave his numbers. It was a really great video. It actually got a whole lot of traction online. So thank you guys for watching it. A listener left a comment and said, quote, "I'm in the same boat. LDL is 248. My calcium score is 0. I was reluctant to take a statin to gain 4 more days of life." And that was J-Matt said that. So thank you, J-Matt. That started another bigger conversation here at the office. So Dante, let's use that as a jumping off point.
Yeah, I like that. I like that question a lot. Again, I think it's a common place for people to be.
Yeah.
And as always, there's many levels before deciding, whether or not a treatment is a good or a bad idea. And so this ultimately brings about the question, if I have my coronary artery calcium measured and it's 0, does that mean I can simply ignore my lipid panel or just avoid taking these lipid lowering medications altogether? So we can unpack that a little bit.
Yeah. What's a calcium score?
So it's just that. It basically quantifies the calcium deposits that can be found in the arteries that are directly feeding the heart.
Okay.
So when plaque accumulates in these arteries that feed the heart, it has the potential to stabilize or calcify over time through a variety of mechanisms. On a CT coronary artery scan, which is the way that this is measured, it's very difficult to detect the plaque in and of itself, but because of this calcium portion, which has a higher density and just due to the nature of the scan, the high contrast of it against the surrounding elements just makes it a good marker for the presence of calcified plaque.
Okay.
So you're not directly measuring plaque; it's almost a surrogate measurement for, is there plaque in the area? Has it begun to calcify?
It's a bad analogy, but it's kind of like if you can't measure the bricks, but you can measure the mortar, you can go, well, based on how much mortar we have, it's safe to guess that we have this many bricks.
Absolutely.
Okay.
I think, that's a great example. So again, we just need to notice that we're talking explicitly about calcified plaque. So a traditional CT of this scan, which does not use contrast dye, it does not reliably detect, nor is it really designed to detect the non-calcified plaque. So something like a CT angiography, which is just a different process, it's more invasive. Since it does contain a contrast medium, it can and has the potential to pick up a little more of the non-calcified plaques, but it's just not something in his situation or in just a general screening setting that you're going to jump to a coronary artery angiography.
So angiograms are more, you said they're more invasive. Is that the one where you have to, they put you under and
yeah.
Okay.
So there's a little camera that
literally travels your arteries.
I believe so.
Yeah.
Yeah. Not a cardiologist, obviously. So.
But the point is,
we're just opining on cardiovascular topics. You know,
well, if we, all we have to do is know more than everybody else,
right?
That's listening.
Yep.
So if you're a cardiologist and you're listening, go somewhere else. No, that's not true.
Go back to work.
Yeah. Seriously, what are you listening to this for? Okay. Anyway,
They want to know what they should put in their yogurt. That's why
I mean, there's some give and take.
it's true. It's true. So let me make sure I'm following. The calcium score is one more way of trying to understand how much the LDL cholesterol, or the small particle cholesterol, has turned into plaque in your body and is therefore obstructing your arteries, making you more likely to have atherosclerotic, I can never say that word right, right? Atherosclerotic events.
Yes.
And aside from opening you up or sticking a camera in your artery, one of the ways they can do that is with a CT scan that looks for calcified plaques, which are some of them, but not all of them. And theoretically, if there's a large number of calcified plaques, it's a safe bet that there's a large number of plaques all over. And conversely, if we don't see any calcified plaque, it's theoretically a safe bet that there's not a lot of plaque. Is that what you're saying?
We could have ended the episode right there.
Boom.
Until the last point.
Oh!
So you said that if you don't, you mentioned that if you don't see calcium,
right,
you can feel fairly confident that there's not a lot of plaque.
And that's what this guy's saying, is that his calcium score is 0.
Yes.
So,
and I think that is the crux of what we want to unpack. And I know I was just, we're kind of just, getting everybody familiar with the terminology more or less, why we keep saying calcified versus non-calcified versus plaque versus calcium. I think it's important to distinguish those again, because just because calcium isn't showing, that doesn't mean there isn't already active atherosclerosis starting to occur.
Right.
And not to jump too far ahead, it's really, this may be a little bit reductionist, but we are generally more concerned with non-calcified plaques than we are the actual calcified plaque.
Okay.
The non-calcified plaque, you can just view it as, hey, it's plaque that hasn't stabilized yet. There are even there's almost what some might consider almost like a protective effect of some of this calcification.
Okay.
So for example, in like high level endurance athletes, people who have been training in that realm forever, they have some structural changes in their hearts that some maybe are a little bad. There's like maybe some higher risk for arrhythmias in certain instances, but a lot of them look really good on all other metrics, all other risk factors, but they have some of this calcified plaque.
Interesting.
Now, not to kind of circle back to that, the plaque that hasn't stabilized is key. That's what has a greater propensity to break off and cause thrombus downline, to cause blood clots, to cause heart attacks, ischemia, all those different things.
Okay.
And so just because there's no calcium on your score or it's low doesn't mean we shouldn't be concerned about it developing. So that's why age is very important. If you took this scan on a 14-year-old,
right,
you would not expect to see any calcium.
Right.
Right.
If you saw calcium in a 14-year-old,
you would be concerned.
It's a problem.
Yes. So this test is designed or is more useful in a kind of a more of a narrow set of patients. It's not necessary. It's not for everybody. So notice this isn't like, hey, I went to my PCP, they took my blood pressure and they have me signed up next week for a coronary artery calcium.
Right.
But that's what a lot of people want to do. They want to see that extra reading, and not that it's necessarily harmful to know.
Right. It's
just that for some people, it'll give you a false sense of confidence. And for others, it gives you maybe a false sense of worrying because again, there's something to the positive nature of some of that plaque to calcify over time. Even if we look at it this way, individuals who are on statins, they have a greater likelihood that some of those plaques begin to stabilize over time.
Oh.
So as you can see, there's something going on there.
So for the people that don't want the long version, what you're saying is just because your calcium score is 0, if your other numbers are concerning, if you have high risk factors like high LDL cholesterol, that doesn't mean you're necessarily safe. You should still be concerned, look into, do the checks, etc., all the things.
Right.
That's the punchline. But for the people that are more interested and want to go deeper.
Yeah. So I think that allows us to talk a little bit more about atherosclerosis in general.
Absolutely.
Because again, it's not as much as we've talked about cholesterol, the importance of statins, why maybe they get a bad rap or however you want to look at it.
Yep.
It's not just about one of those levers. As we know, it takes many years usually for this disease process to take shape. Essentially, this injury that occurs to the arterial walls, it jumpstarts a whole inflammatory process at the innermost layers of the blood vessels. And it's caused by things like smoking, hypertension, diabetes, and then the last big lever that we just mentioned, LDL cholesterol or the bad cholesterol or ApoB containing particles or containing lipoproteins. So for a lot of people, it's a combination of these factors. For some people, they have all of these factors in check. They never smoked, their blood sugar's in check, and they might have familial hypercholesterolemia or a propensity to have, not process cholesterol like for the person next to them. And so when you're just trying to address this global risk of ASCVD and to prevent these events, jumping back to his comment, sometimes it's not just about, adding 4 days to your lifespan.
Right.
It's more global than that. It's what happens when maybe you have some control over, or you like to think you have some control over one of these very devastating events occurring.
Yeah. And
so it's less about just adding days to your life, more about quality of life, less burden on yourself, less burden of going through, what comes of an event or a heart attack, a stroke, all of those sorts of things.
Right. Yeah. These things don't typically happen in a vacuum. Or it can, but it's not usually somebody that you go, I would never have imagined that person would have a heart attack. That's not the most common situation.
Anybody can have a heart attack for a variety of reasons.
Right.
It's just, we're always, I know it's such a kind of a general cop-out sort of statement to make, but there's a million ways to try to manage your risk. We know that these are like the 4 or 5 biggest ones. And so it is what it is.
Yeah.
It can still happen, or you could be the person. Everybody uses the example of the 85-year-old smoker, they're never on any meds and they live forever. My grandpa.
Yep.
That's great. That's great. That can be you.
That can happen.
But we're just managing risk as best as we can.
Yeah. You could also win the lottery.
Exactly.
Possible.
Exactly. So controlling what we can control. So to expand a little bit on the, ApoB containing lipoprotein portion or the LDL cholesterol portion, essentially what happens in this disease process, or these little proteins become embedded in the arterial walls. And then back to that inflammatory response, all these immune cells infiltrate the situation ultimately to what I estimate to try to make the situation better or shunt things where they should go. And what ultimately happens, it creates these foam cells and later what are known as fatty streaks.
Okay.
And so these are all hallmark terms for the active disease process, or this disease process really taking shape. The presence of all this stuff eventually leads to narrowing, hardening, squeezing of the arteries, again, signifying the presence of this disease process. So it's not just about necessarily like what's in there. It's this stuff is embedded in the walls. It's inflamed. They can be constricted.
Right.
The plaques and then the calcium, even on like the outside of the arteries, can actually
squeeze
even more.
Yeah.
So sometimes, again, it's less about like what's in the lumen, but what's, from my understanding, like it's like literally being compressed.
Yeah.
In a way, you look at like I heard a cardiologist mention, like you think about a roll of toilet paper, like you just squeeze it down.
Yeah.
The presence of all that stuff is not just about what's inside, but also what can be compressing down. So you might have a very low calcium score, but there's still compression. There's still these other things that can happen.
And I would wager that that happening at all makes further damage more likely because of the compression. Is that fair to say?
Right. So, I mean, that's a, you know, kind of just a quick overview again of the different risk factors. And then specifically, since he mentioned the cholesterol portion in his comment,
right,
as to why that can be pretty damaging. We don't know how, we don't have a specific timeline on how long it takes for for persistently elevated cholesterol
right,
to cause issues or to become visible. We can't tell you exactly. We don't even know how old this gentleman or lady is. It's
a comment on a video.
Right.
We don't have a lot of details.
Exactly. So again, I hope that this at least just opens that way of thinking to a little more, to zoom out. It's never a bad idea to zoom out on something like this, right?
Absolutely.
These scores, they do serve as a strong signal. Again, as much as we've presented the negative part, they do serve as a strong signal that atherosclerosis is present. So I don't want that to get lost in this, conversation. The scoring in and of itself can help us, can also be used in tandem with the other risk sort of algorithm calculators, percentages that we use to maybe determine if somebody's a good or better candidate for statin or for other interventions.
Right.
So it is another piece of the puzzle. Absolutely. So this isn't just to completely shut it down. It's a strong predictor of risk. It's a strong predictor of risk for future events. Coronary heart disease, for example, again, and ASCVD. There is the statistic that the presence of coronary artery calcium indicates a 2.6 to 4.3 fold increased risk. Yes, of coronary heart disease, and a 2.1 to 2.6 fold increase in the risk of ASCVD.
Okay.
Compared to a score of 0. So again, it's very...
Yeah, score of 0 doesn't mean you have no chance. It's just your chance is X. And then if you have higher scores, it's that compounded.
Right.
So if I understand, again, I want to just make sure I'm hearing you. What you're saying is the score, if your score is 0, that doesn't necessarily mean you're safe. It just means it hasn't calcified.
Possibly.
And if your score is higher, that is a very good indication that you have some serious risk factors and are at a much greater risk.
Correct.
So
and you can assume that there's probably some uncalcified plaque as well.
Right.
But also if you're 85, you can already, instead of running the test, you can assume
right
that this person,
because as we age, that's just a part of it to some extent.
Yes.
Okay. So I get the test done. I have a higher calcium score. So I know that I'm at a multifold increased risk of negative atherosclerotic events. How do I bring that score down?
In general, my understanding is that we're not likely to bring the score down.
Darn.
And so the goal is to, if there is a lot of free plaque, so to speak, in there, that we can get that to stabilize. The goal would be to manage additional accumulation of plaque and nasty particles, foam cells, like we mentioned, manage that via the risk predictors that we talked about: smoking, hypertension, controlling those things, high blood sugar,
smoking, hypertension, high blood sugar, type 2 diabetes.
Yes. LDL cholesterol.
Yep.
Yes. Managing the atherogenic load
right
in the arteries.
Statins.
Yes. And so while it's meek, or whatever the word is, negative, that maybe you can't reduce the score, the goal again is to try to see, by way of these other interventions, to get some of it to again stabilize and to prevent additional from accumulating. So in this gentleman's case, or woman, for example, you would be likely to see the doctor recommend intervening on that elevated LDL cholesterol reading.
Right.
Absolutely. Because it's an important pillar of managing that risk, because it might be 0 now, depending on your age. We don't know what's floating around. We can't, beyond doing a really sort of invasive, additional, is it really worth that?
Yeah.
You know what I mean? Would it really? Probably not. So beyond like literally getting in there and checking, we don't necessarily know what what it looks like from a plaque standpoint. We can just assume, again, just looking at this globally, that an atherogenic load that high, such as the reading that he mentioned, we can assume there's probably some plaque. There probably is. There's maybe some pushback on that. Again, just in the camp of, see, I've been carnivore for all this time and it's done nothing to my blood sugar or blood cholesterol levels. Well, that's certainly possible. We're just trying to manage risk.
Yep.
So you, again, like we mentioned a little earlier on, was so let's just say they decide to start a statin. Again, maybe we start to see if they were to repeat the coronary artery calcium, which is unlikely, but maybe they repeat it. And the hope is, again, if there was some plaque beginning to accumulate that was missed on the first one, that maybe we do see some calcification signifying, hey, we knew there was some atherosclerosis. Now we actually see this trend, maybe trending a little more positively. This is stabilizing.
Interesting. So
I don't think they use that as a metric to say, oh, this is how well statins are working. I don't mean that.
No,
but in a theoretical sense,
it would not be surprising if this person starts a statin, they go back and retest, their LDL-C is lower, substantially lower, but their calcium score goes up because that plaque has a chance to stabilize, and so it makes a negative score actually sort of a positive.
That is,
in a weird sort of way.
That is absolutely the paradox that can occur.
Wow.
Yes.
Again, the punchline I heard you say is, when you find yourself in a hole, stop digging. If you have plaques building up in your arteries, you should stop adding to that. Do what you can to reduce your cardiovascular load.
100%.
Makes sense to me. I hope that helps. Thank you for that comment. If you guys want to have questions answered, please send us an email, questions@askjoedimatteo.com. That's questions@askjoedimatteo.com. Or just leave a comment on the video. We like that too, because then everybody can see it. So either way, we love it. Thank you so much. And I hope that helped. Joey, we talk about lots of different supplements and lots of things that are kind of universal, used for a lot of different situations. This one is for a very specific situation. What are we talking about?
Today, we're talking about Prenatal Complete with DHA.
Aha.
All right.
So I know what that's for.
That is a new product, and it's the first time we have ever updated our prenatal vitamin. So it's been with us for a long time. It was time to get some of the forms of the vitamins and just overall looking at an update to that product. So the product provides micro and macronutrients that are essential for fetal production, particularly for the fetal nervous system. And it's not just for while the woman is pregnant, it's preconception. There's important factors there, prenatal and postnatal. Okay. But particularly postnatal related to lactation breastfeeding. So the biggest improvements, what makes this product special, but over our previous prenatal, and also the comparison here that's important is to your basic store brand prenatals, because they're out there and there's a lot of them. Yeah. You may even get a prescription for one, et cetera. So early in pregnancy, and I think this is why, because we often talk about related to supplements, well, what about diet? And we never want to de-emphasize that. But particularly here, early in pregnancy, which is the most important phase for this product. I know I just mentioned this for all three, but that's really critical. What are we dealing with? We're dealing with persistent nausea, morning sickness. So eating at all, let alone healthy eating, is difficult. So that's why it's particularly critical. From a health standpoint, though, the theme I want to hit on here that we often do in these is bioavailable forms of the nutrients. So it has methylfolate, not just folic acid. Okay. It has it in 1,000 micrograms. So it's not some mega dose, but it is a dose higher than you'll typically see in your average prenatal product. And it's critical for the most critical ingredient for fetal nervous system development and the neural tube. It prevents neural tube defects such as spina bifida. Also for the mother, this is primarily for the fetus and the baby, of course, but for the mother, folate supports red blood cell production. So I think any mother who's been through pregnancy can attest that red blood cell production is critical.
Yeah, absolutely.
So Preconception, we'll start there. Research shows that healthy pregnancies begin with healthy nutritional status. So this is something you want to start while you're trying to conceive. Folate in particular, again, at that early initial phase of fetal development is critical. So we have the methylated bioavailable form of folic acid. Again, folic acid for the average person in general, whenever you're supplementing it, is fine. But there's a significant proportion of people that have the MTHFR gene mutation, and they're not able to convert it well to the active methylated form. So we also have, along the lines of the bioavailability, chelated forms of iron, calcium, zinc, selenium, magnesium.
Wow.
Chelated means, in chemistry terms, bound to minerals. In this case, it also means bound to amino acids. These chelated forms are critical for absorption. They're the forms that are found in whole foods. For example, the magnesium, the chelate is absorbed 8.8 times the absorption that you will see in mag oxide, which is the standard magnesium you'd grab off a shelf, is the form that's in, your average store-bought prenatal. The chelate is also absorbed 5.6 times the availability, the absorption in the sulfate form, and 2.3 times the carbonate form. So significant, no matter what you compare it to. Magnesium also plays a critical role in fetal development. So the recommendation, and this includes diet, but the overall recommendation is between 300 and 350 milligrams a day for pregnant women. Sources of magnesium: spinach, kale, almonds, cashews, brown rice. Of course, attainable through diet. But again, just when you're looking at your true average diet, are we really eating enough of those things? And for such a critical mineral, such a critical time.
Yeah, especially
phase.
Early on in pregnancy.
Exactly. Calcium in the chelated form, twice as absorbed as common forms such as carbonate, citrate, and even hydroxyapatite. That is critical for the bone and teeth formation in the fetus. Also muscle functioning and development of blood clotting factors. So you're looking at 1,000 to 1,300 milligrams recommended per day. Again, not necessarily easy to get through diet. Prenatal Complete contains 150 milligrams, so it's not some mega dose, but a significant amount just to make sure that it's not lacking. Calcium supplementation has been linked with lower rates of preeclampsia, which is a pregnancy complication characterized by very high blood pressure. So they've correlated levels of calcium in the supplementation with a decreased risk of that. Iron chelate versus what you typically would see is a ferrous or iron sulfate. 3.8 times the absorption in the chelate form. So that's, obviously significant. And also the chelated form leads to less constipation, less GI discomfort. All right. Iron critical for oxygen delivery from mother to baby. And research shows that 20% of pregnant women have low hemoglobin and iron levels. Another one that I found very interesting was that this contains iodine. So iodine is critical for the thyroid and nervous system development, also brain development in the baby. It's also very critical in the postnatal phase for breastfeeding, that mothers' iodine levels are adequate. And then lastly, there are other ingredients. Again, it's functioning largely as a multivitamin, but these are the important ones. Omega-3s, particularly DHA, is critical for a developing baby and young child. It's possible, back to the same theme we talk about a lot, it's possible to obtain enough DHA from your diet. But when you look, are you truly eating daily servings of tuna, sardines, salmon, etc.? Along those lines, in 2022, there was a study that looked at 902 pregnant women. 437 women were taking 200 milligrams of DHA. The official recommendations range from 200 to 600. So this was the low end, but still in the recommended range. And they compared it to women taking 1,000 milligrams. So yes, above recommended, but not an abnormally large dose. The study accounted for factors such as smoking, BMI, ethnicity to control for the quality of the study. They found a significant difference in the delivery time, in the an improvement in delivery time to full term in the 1,000 milligram cohort, even versus the 200. So a much lower rate of preterm delivery.
Wow.
And they were able to explain it by looking at inflammatory biomarkers. So they not only saw the data in the results, but they saw, it was really interleukin-6, an inflammatory marker that they saw, that it correlated also to the increased delivery time in full term. so they could kind of see why. Further, they found that there's a greater benefit among mothers who at the baseline of the study, at the initial phase, had low DHA levels. So you moved the needle more there, you saw an even bigger difference than the bulk of the study. Also linked DHA supplementation to lower NICU admission rates.
Wow.
And also higher birth rates when you look at the overall health of the child. So Prenatal contains 580 milligrams of DHA. So the usually what you'd be getting is 300. So it's already almost double that.
Yeah.
Plus, hopefully, you still are going to encourage you to get some through your diet.
Absolutely, man. That's fantastic.
Yeah, and related to diet again with fish, particularly if you're not getting the most quality fish, you are at risk for some mercury contamination, other contaminants with this fish oil. That's in this form. It is highly purified via molecular distillation, extensively tested to make sure it's free of mercury and heavy metals. So with a developing baby, that is certainly critical.
Yeah, you don't want to take that chance.
No. So other nutrients included, like I mentioned, that this is still functioning as a multivitamin for the health of the mother as well. A, C, D are all in there. Vitamin D, it has a little higher than you're typically going to see. It has 2,000 units. So not a mega dose, still a dose that we often recommend for people who come in and ask for supplementation. And we would still recommend you get a level. But they have found that in mothers with healthy levels of vitamin D, a lower rate of autoimmune disease and also ADHD.
That's what's wrong with me.
That was it, huh?
That must have been.
So yeah, and as usual, no gluten, no yeast, no artificial colors, no flavors.
That's fantastic. So how many does a woman typically take?
So this one's unique. So to get the fish oil in the highest quality form, it's in the oil form. So you're going to have a soft gel in there, and then you're going to have the capsules to get the rest of it. So it's a little
So it's a
different than a
combo.
typical. Yes,
Okay.
exactly. So and just one of those servings a day.
Okay. Very, very cool. That's fantastic. And any rules in terms of when it should be taken with
Probably with a little bit of food's a good idea. Yeah.
everything that's in there? It makes sense.
Exactly. A little bit of food, and especially with what often, especially in the early part of pregnancy, moms are dealing with. So
Yep.
take it with a little bit of food.
Absolutely. Very cool. I am so glad that we have updated this. Thank you, Joey, for helping us understand that. That's it for us this week. If you have a question you would like answered, please email it to us. questions@askjoedimatteo.com. That's questions@askjoedimatteo.com. That site is also where you can find out more about this show, the past show, and find all of the products that we talk about on the show, all there on that website. Big thanks, as always, to everybody that helps make this show happen. And if you learned something, please share it with somebody you know, somebody that could also use this information. That is the best way to help us grow. Have a great week. We'll see you again soon.